Hello, everybody. We are live. Sorry about being a little bit late for the live. YouTube was having some troubles, and we managed to get around the troubles. So, today we are going to be talking about Shockwave. Um, Shockwave is an amazing new technology. I've had it in my office for a little bit, and then I ordered one, and now it is here and back for good. Patients are absolutely loving the capabilities of the Shockwave, and what we were able to do is deliver for patients some instant gratification, meaning patients are noticing 80 to 100% improvement on their pain and condition from the beginning of a treatment that takes anywhere between 5 and 15 minutes, depending on the body part, anywhere from 80 to 100% improvement. Now, depending on your condition, many people will need more than one treatment, especially if it's a chronic condition. But still, the typical treatment sessions are a maximum of like 12 visits and spread out over a week apart. So it's not something you have to take a ton of time in to come multiple times a week. And again, the average treatment is between 5 and 15 minutes. So, what are some things that can be helped with this focus shockwave? Well, yesterday I helped with carpal tunnel, gamer's thumb. I helped with shoulder injuries. It can help with frozen shoulders, rotator cuff, a patient that was struggling with sleeping on their shoulders. It also helps with elbow conditions like golfer's elbow and tennis elbow. Plantar fasciitis, if this is something you struggle with, this can really help with plantar fasciitis. For myself, I didn't even know it, but I had some Achilles tendonitis. So it is helping me with the Achilles that, again, I didn't know until I started using it in different areas just to test it out. I used it on my Achilles and I was like, whoo, okay. I must have some tendonitis deep down in there that I did not know was going on. So that's the cool part. This technology gets way deeper than most technologies that have been out for long periods of time. Um, what do I mean by goes in way deeper? Well, it penetrates deeper past just the soft tissue. So, like with a massage or even with laser treatment, a certain depth, but it's much less of a depth. This can get right into ligaments and tendons and bones and speed up the healing. Um, and it was originally used to break up kidney stones for patients that struggled with that. And then they developed this technology to be used for a variety of other treatments. It's actually in one of the companies that is studying it and using Shockwave. They are studying it in its trial period for things like dementia and Alzheimer's, which is just really fascinating how this technology has been discovered and now is being utilized for many different areas. So, what are the different types of shockwave? Maybe you've never heard of shockwave. Maybe you have had shockwave. One of the types is a radial shockwave, and that's done with more ballistic and more on the surface level. And then there's different types of shockwave that penetrate deeper. Uh, what we have is a focus shockwave that I use in my office, and that Waves Regenerative Therapy is now going to be providing. Why? Because we found it is the best for treating patients and the most cost effective for physicians buying them to treat patients and for patients to spend their hard earned dollars and get treatments. It's also uh, much quieter than some of the other technologies out there. It does make a noise though, so you will hear it. Unlike if you've had ultrasound, it looks like the machine that you would use on a diagnostic or a treatment ultrasound, but those you don't hear noise with. This machine, you will hear a noise. Um, and also with this machine, you will feel it more. because that's the intention, that we want to find the area that you're feeling and we want to start treating that area. So the cool part about the different types, there's some of the shock waves that spread out more surface, like the radial. There's shock waves that go deeper still, but then they spread out. And then there's the focus shock wave. With the focus shock wave, we can really zero in helping you to find where the specific areas that are the biggest problems. And with that being said, we can concentrate the healing to that area and speed up the healing. But it also, I really like it because it helps us really diagnose where the bulk of the problem is coming from. Um, so when we're using it, we can really communicate with patients to see, oh yeah, maybe you thought this was from one aspect of your shoulder and it's in a different aspect. That helps us not only with the treatment of the shockwave, but if you're going to a healthcare provider and doing other types of things for your back, your spine, your shoulder, your knee, your ankle, your elbow, wherever you're getting treated, it can help to improve the type of treatments that we're doing for those conditions. And today, since we have the machine in our office, we could show you what the machine looks like, the types of areas that can be used on. You do need to use it directly on skin. There is an ultrasound gel that's put on it. It does need to be used in a doctor supervised, because there's certain conditions that we can't use it on. So, like any healthcare results, any healthcare equipment, anything we're taking, we want to make sure that it is something that, number one, it can be used on the particular person that it is being used on. So we want to screen and make sure that things like, for instance, if you have a shoulder pain, especially in a lot of these chronic conditions, you might be getting steroid injections. Well, if you've had a steroid in the area, well, we wouldn't do a type of shockwave treatment for 6 weeks after getting that type of a treatment done. If you've had something surgically replaced, if you've had, like, let's say, one knee replaced, well, we can't use it on that knee. However, if the other knee's giving you trouble and we want to prolong or potentially avoid surgery on that other knee, we could use the shockwave on the another area of the body that does not have that equipment on there, the metal inside. It's also something that we don't want to be using on patients that are pregnant, under 18, or have anticoagulants in their bloodstream as well. Um, so let's take a walk over and see exactly what this technology looks like. And then you will be able to decide for yourself whether it's something that you think that you want to try out. All right, with me here as we're going to move the technology with us so we can see exactly what we are looking at. It might get a little dark and you might hear a little bit of moving around of the microphone. I do apologize. The pros and cons of being live. All right, so let's check out the prize package here. This over here is our piece of equipment. So this piece of equipment, you can see, comes with a handle to use for treating the patient. And then, again, when you turn it on, it looks something like that. And then I can also see if I could turn it on and use it so you can hear how it sounds. Okay, so you take this out. And again, if I was doing an actual treatment, I would be putting some ultrasound gel. And we would put it on the surface. And we would turn it on. And you can hear, makes a bit of a noise there. And since I'm doing it in an area that does not have any condition going on or any pain, it actually doesn't feel like much at all. But if I had something going on in my wrist, I would really feel that. And then you would have that treatment going in and out of that area. And by the end of the treatment, it really is amazing at how people are responding and how much better that they are feeling by using this wonderful technology. So, where can you get this technology? Well, you can ask your physician, ask your doctor. They might have it in their office. You can Google focused shockwave technology or any type of shockwave technology. And I encourage you to seek it out, try it out. A lot of offices like myself are running specials for the first treatment, so you can get an experience of how it feels. And then there's different types of pricing that is given after the initial treatment. Um, I think you will find it will be well spent money if you're having any type of pain, especially if it's chronic pain, to heal those areas. Unfortunately, in most areas, it is not covered by insurance, um, but every state and every insurance company is a little bit different. So if you'd like more information on this Focus Shockwave, where can you find it? Well, here you can find it in Southeast Michigan at Back to Health and Wellness Center in Utica, Michigan. Um, you can give us a call at 586-254-3303. If you want to get a hold of us at Waves Regenerative Therapy to learn more about the technology, you can look us up on Facebook, look us up on the web. We also are going to be having a webinar on December 10th to give more information specifically about this machine for doctors or if patients are interested in more information. And that is going to be at 8 o'clock Eastern Time on December 10th. You can find me at Instagram or on Facebook. On Facebook, Keith Brennan, you can look me up. Also, Back to Health and Wellness Center. You can also find me on Instagram, and my Instagram handle is Dr. Brennan, Brennan, Wellness. And DM me, message me, and we will get you more information about this Focus Shockwave. Really, what I would just encourage you to do is try it out. Don't just listen to this, but take action, find a place that has one, and utilize it because it's just an amazing technology. I've seen it on patients, I've seen it on myself. And if you step out and use it, start reaping the rewards. Thanks, everybody. Again, if you're interested and you're a physician, especially, and you might want to have one of these in the office so more patients can get help with this, check out our webinar. It is at 8 p.m. Eastern. I think I said 8 a.m. Eastern. We are not doing it early. We're doing it at the end of the day. It's at 8 p.m. Eastern, December 10th. There will be myself, Dr. David Warman, who's been using Shockwave for much longer than I have in his practice. And also our wonderful support staff will be there to answer any questions. Also, if you are someone who is looking at getting one of these for your office, we are running specials for Black Friday and Cyber Monday. And it is a good chunk off. So you will want to be interested in that. So again, reach out. You can message me here. We can set up a 10-minute call or set up an email chain, text chain, whatever is most efficient for you. I know many people are starting to hear about Shockwave, but maybe don't really know the differences between the different products. happy to help you out and have you make a decision that is best for you. With our product, we are also going to be providing the sales, marketing, and how to best utilize it for each different condition that you could be using it for. So it's not just going to come with the machine and here you go, figure it out. How do you help people out with it? But how do we help people out? Let's show you how to help it out best. Let's show you how to educate your local communities at what you can help them with. If there's not any other questions, we're just going to keep it short and sweet. Sorry, YouTube was having some technology issues, so I started a little bit late. But hopefully, this information was super helpful for you. I cannot wait to go use that lovely shockwave treatment on patients this afternoon and evening. Everyone, have a great day.